Today we're here to bring together a variety of stakeholders in healthcare, but with a focus on the employer community, the business community. You know, healthcare continues to be an important issue nationally at a policy level, but it's also really important as a business issue. What we hear and what we talk about is that health insurance costs, which are driven by healthcare costs, are typically the second largest item in a company's budget after salaries, the cost of their people. And so it's an important issue for the business community. We also know that healthcare is complex. The problems, the cost problems, the quality problems we're facing, we've struggled to solve those as a healthcare industry. And our belief is that by bringing together the employer community, the business community with the healthcare community, working collaboratively is the best way to address the fundamental issues that we need to tackle to bring down healthcare costs. We're really proud that this is the third year that we've been able to sponsor this along with our partners here in New Orleans, GNO Inc., the Chamber, and the New Orleans Business Alliance. I think it's a testament to the fact that it is a relevant issue, and the fact that we have more people coming this year than we've had in prior years, I think, is a signal that we're onto something. So we're really delighted to be the sponsors of this, and we hope it's a productive dialogue that leads to some concrete actions to help our business community.
I think the key message that we want to get across today is how important the employer-provided coverage system is, not only to making sure that we achieve universal coverage and that people have access to quality, affordable coverage, but to the entire healthcare system itself, and why it's so important for a lot of the folks in this room, from individual businesses to the Chamber, to recognize that offering these benefits is really important not only for their employees, but for the sustainability of our entire healthcare system.
I'm Dr. Corey Hebert, and I know you've enjoyed already this.
I'm Dr. Corey Hebert, and our breakout session today deals with wellness in the workplace. Many years ago, people didn't really care that their workplace was a place that they needed to go to also feel very comfortable and happy and healthy in their lives. They felt that that was home, and then when they went to the workplace, then they felt that they should just get beat up and overworked and underpaid, and that was the deal. And now we realize that that actually stops productivity. It makes everything negative in the workplace, and then at the end of the day, it costs the workplace money. So what we're going to talk about today is how people can put more wellness programs into their workplace, because it's actually a very good investment in the outcomes of their business.
The reason wellness is important, and I'll just use one example, obesity. It is much harder to get people back to a normal body weight once they've already become obese. The best way to deal with obesity is to prevent it in the front, to help people lead an active, healthy lifestyle where they don't get into trouble. And so wellness for employers, for the business community, is really all about preventing whether it be disease or exacerbations of disease, and keeping people healthy and, from a business perspective, productive. Because when people are away at the doctor or the hospital, they're not at work and not contributing.
As a physician, what would you recommend to employees, particularly those that sit at their desk most of the day?
Don't. I want you to make sure that you get up, and if it's possible, to have one of those standing desks where you can actually make it go up to stand and then sit, and make it go down to sit down. And also, you should get up and get one of those fitness trackers and move. And if your office actually does have a place where you can go as a workout facility or track or something like that, I think that it's important that you do it, because if you don't move it, you're going to lose it, and that's what we know.
Our breakout session today deals with innovation to improve the services that Blue Cross provides its members. And when we talk about service, we don't just mean service that we provide to members directly, but services that our providers and partners provide. We think that information and advances in how we use information is key. I think really what we're at is a cusp, or the start of the ability to leverage information in ways that we haven't before, to improve the health care that's being delivered and to improve the value of the health care that's being delivered. So we're talking about improving efficiency and decreasing cost.
What kind of results have you seen so far?
We've had marked results in the health outcomes. We measure those with a set of metrics around the quality of care that's delivered, and we also have been able to bend the trend on cost in some difficult areas like drug cost and the absolute delivery of care for those providers who are partners in this effort.
Put on this form how many employees you have, part-time, full-time. Our breakout session today is going to deal with a lot of new federal regulations, short-term health plans, association health plans, and 2 new letters from the IRS that are causing a lot of angst in the business community. The IRS letters are designed to enforce the original employer mandate that was passed in the Affordable Care Act way back in 2010. The IRS has now got all of the information they need to start sending out fines and penalties, and the letters are notices of those.
What kind of response have the companies had?
Well, it's scary. If you get a letter in the mail that says that you owe $200,000 within 30 days, that's pretty terrifying. So we've been trying to help coach them through responding and to help answer the IRS's question.
What recommendations do you have for businesses in Louisiana?
It's very important that they revisit the rules in the employer mandate and make sure they're counting their workforce in the method the IRS requires, and also make sure that they're filing all of the paperwork. I'm talking about 1095s, especially C model 1095s, back to the IRS each year.
My message is really to talk a little bit about the association health plans and what that looks like in the future for the state and for the industry. I'm also going to talk about short-term limited duration policies and what those actually, how those impact the individual market. There are many changes coming through the pipe, through the federal government and state government, and that it is important to keep your ear to your broker and agent because they can be your source of information for healthcare.
So the way this works is basically our workshop deals with the affordability of prescription drugs, and that's very important because having an affordable benefit is very important for the health and sustainability of health insurance and health coverage.
What is the trend now in prescription drug costs?
Over the last few years, the trends have been extraordinarily high, and they've been high for a number of reasons. They've been high because of unsustainable price increases by drugs that are already on the market, but also some very important breakthrough medications that are coming on the market that are very, very high cost.
What recommendation do you have for customers?
Well, certainly what customers should do is manage the pharmacy benefit in a way that they're paying for drugs that are needed for patients that need care. But high-cost, low-value drugs that have lower-cost alternatives, programs should be put in place to make sure that not many of those prescriptions are paid for, and instead that we're paying for those prescription drugs that provide a lot of value to the members and help cure their diseases or control their ailments.
Hospitalization is often driven by people.
Our breakout session today deals with the new area of artificial intelligence, and more specifically predictive models that can help us in all kinds of operations within Blue Cross Blue Shield. Clinical management, in managing customer experience and enhancing it. Also really overall managing quality of our provider network. Predictive models, as the name suggests, look at some events that are going to happen in the future. So can you predict what's going to happen? In many regards, they're not very different than things you're already used to. For example, Amazon can predict which books or products you want to buy. Google can predict what are you looking for and can give you suggestions. Music sites can help you imagine what music you might like before you've actually chosen it. So the very same technology, as I said, which is based on artificial intelligence, can be utilized in healthcare to predict diabetes before diabetes happens. Looking at people who may not take their medications, people who are having financial challenges, or for that matter, specific healthcare challenges in navigating with the healthcare system, obviously at a time when they're most vulnerable. So if we can predict these things ahead of time, we can actually take care of them ahead of time. We have several hundred nurses who work in our care management department whose sole job is to help navigate and coordinate care.
Now, what I'd like to do for a few minutes, as I've done in prior years, is really just set the stage for the issues that we're going to talk about. As I mentioned, we started this when we thought that healthcare was in turbulent times, and those turbulent times unfortunately continue. A lot of that has been focused still around healthcare reform and the Affordable Care Act. On the good news side, some of you may have read that the Louisiana Department of Insurance announced that for the first time since the Affordable Care Act was passed in the individual market, we are going to see a decrease in individual premiums. That is good news. And the reason that that's happened is that the insurance industry's premiums have finally caught up with the high risk of the people that are buying health insurance in the individual market. It's also a byproduct, I will tell you, a very focused effort collectively on our part as an industry to work with the provider community and others to keep medical cost trends down at a very low rate. The bad news is that the individual market in Louisiana is only about half the size as it was at its peak. So instead of 200,000 people being able to afford health care insurance, only about 100,000 people are, and most of those people can only afford it because it gets subsidies for the federal government. So we really haven't solved the health care cost problem for the individual market. And I would like to say that the market has stabilized, but we continue to see changes not out of D.C. but around the country. As some of you may know, we get risk adjustment payments for that high-risk population. We thought that was solved. There's still ongoing lawsuits. And it may seem like a distant policy issue to you. For us, it's a $40 million issue, which is real money. And just remind us that when we got into the ACA, before we were able to stabilize it, we lost well over $200 million trying to get into that market. So I'd like to say it's stabilized. I don't think it is. We need legislative help, and this is not to be critical of the state legislature, but I was disappointed when we as a state had the opportunity to introduce a reinsurance program at the state level that would have brought individual health insurance premiums down by 20 to 25%. We couldn't get consensus around the state to do that. Other states, Minnesota, Alaska, have done that, and that would be helpful for us. If we can't do the state level, maybe we can get that at the federal level. But those are the kind of reforms we need to further stabilize the individual market. Now, most of you get your health insurance through the employer market. Obviously, this is a business forum. And while you haven't seen increases to the level of the individual market, you continue to see costs going up, and we know that that is a problem for the business community. The reality is that healthcare insurance is typically the second line item in your budget behind salaries, and health insurance is driven by the cost of health care, which goes up. And so we're going to talk today about the drivers. You can hear about that in the breakout sessions, and I'll just call out one driver just to give you an idea. Pharmaceutical costs. Today, we spend more for pharmaceutical products and services than we do for physician services. And one of the reasons that's happening is the price of the individual drugs. We are not only seeing new drugs come out at $500,000 per treatment, we're beginning to see drugs come out approaching $1 million for treatment. And if you're a self-funded account, an employer, and you get one person that gets one treatment, or worse yet, 10 people that get 10 treatments, you could easily be looking at $5 to $10 million of unexpected costs. The Kaiser Family Foundation in 2016 said that the average cost for a family of four coverage through employer-sponsored health insurance is now getting to about $18,000, which is about 60% higher than it was 10 years ago. But for employees, that cost has gone up about 80%. So as an industry, we have moved a big part of that cost increase onto employees. Now that is good in terms of engaging employees, asking them to have skin in the game. But I will tell you that while it creates an incentive for them to be prudent users of healthcare services, we need to be mindful of what I would call unintended consequences. What you may not be aware of, and we just recently went through this as an employer ourselves, is our employees now are paying for about 25% of the total cost of health care, even when they have health insurance. And that cost burden is actually causing some people with health insurance not to get care that they think they need. And I'll just give you an example. We recently studied this. Going back to pharmaceuticals, we said, why are the people that we insure not taking their medications when they have chronic illnesses? So we tested what would happen if we waived the copay for their drugs at the pharmacy. And what we found was that compliance shot up when you remove that financial barrier. So giving them skin in the game is good, but we need to be careful it doesn't become a barrier. We've done some additional work that I'll share a snippet of you. We were surprised when we worked with some outside folks to look at this, that the walkaway point, so these are people that go into the pharmacy. They're walking into Walgreens, walking into CVS, walking into local pharmacies with the intention of picking up their prescriptions. When the person at the pharmacy counter says, your cost is over $20, they begin to walk away, even though they're in there to pick up the drugs. And it escalates, so it's between 20, it goes up well over 20% of the people start to walk away at that price point. So we do need to be careful. We probably need to think with you collectively about a new way of engaging people, giving them skin in the game, but doing it in a way that for people who are at high risk with chronic illnesses, we're not inadvertently creating barriers to care that they need. The reason that we need to keep down healthcare costs is not just so that you as employers or you as businesses can compete more effectively. It's an economic development issue, and I've shared this with Michael Hecht a couple times. The reason is that we have huge regional variations in healthcare costs, and unfortunately, the state we live in is a high-cost state. When the Institute of Medicine, I mentioned to you last year, I'll mention again, when the Institute of Medicine studied 400 geographical areas across the United States and rank ordered them, 6 of the top 10 most expensive areas in the United States were in Louisiana. So if you are a business and you're thinking about locating your employee workforce somewhere, and the second most expensive thing behind salaries is healthcare costs, as a business community, how do you think we stack up? So it's not just an individual issue for you, it's a collective issue for us as a business community to attract people. Now, we've done a great job, not just here in New Orleans, but across the state, Lake Charles, et cetera, have done a great job of attracting businesses, but we need to be mindful that healthcare costs can become a barrier to effective economic development if we're malpositioned as a state or a geography against other cities that are trying to attract the same companies that we're trying to attract. So we need to work on addressing healthcare costs collectively, and it's not just healthcare costs, I would say. We need to address quality. As a state, you all know that depending on the survey that you look at, we are near the bottom, 48th, 49th, 50th, take your pick of the survey in terms of outcomes. So we have a bad mix of high costs, not a good health status. Now that health status, we all know it comes from chronic disease burden. We have a high rate of obesity, diabetes, hypertension, et cetera, in this state. Some of that is due to social factors and behavior, and the buzzword right now is social determinants of health. We need to look at that, and we are doing that, and that's not just an issue for us as a health insurer, it's not just a policy issue for local and state governments, it's an issue for employers. And what you can do to help your employees overcome some of those social determinants. And I think that is sort of one of the reasons why we're here together. We need to work collectively on these complex factors that are not just driving healthcare costs, but driving the outcomes for the people that are members, the providers, patients, and your employees. Because when people are ill, they're not in the workforce, they're not being productive in their time away, and so keeping them healthy and productive is in our collective best interests. We believe that as we transition how we attack this, one of the things we need to do is really focus on changing behaviors. We need to change the behaviors of the individuals. We need to change the behaviors of the physicians and other providers that are taking care of them. And we think the best way to do that is not just, again, going back looking at the economic incentives that we can put in from benefit design, co-pays, et cetera, but actionable information and insights. And that's why we've decided to invest heavily in data and analytics. And not just data and analytics for looking in the rearview mirror, but data and analytics allows us to predict which people are going to decompensate, have problems, and give that information to people who can intervene and make a difference in a near real-time way, both to the individual and to their caregivers. We need to redesign how care is delivered using that information. And that's only going to happen if all of us work together, both in the incentives that you put in place as an employer community when you're designing your benefits with us, and how we work together with the provider community and with the individuals. Change is hard. And I will say the reason change is hard is most people are vested in the status quo. And so there's a lot of inertia to get that change to happen. And that's why a forum like this, where we can talk about what our individual sort of perspectives are, but particularly how can we collectively both change and give up a little, gain a little, and make the change is important. So we're really delighted that you're here. In addition to what you're going to hear about in our keynote speaker today, I do want to call out a little bit about the breakouts. That will be an opportunity for you to focus and dive into selective areas. Take that dialogue out of the breakout areas, take it into, again, I said, these informal sessions, because the real benefit of this forum is not just hearing people like me stand up here at the podium. It's really from the networking and interactions you have where you can take things back and make changes in your own company and in what you do day to day. So I hope you enjoy the day. I hope you find it to be productive. What I'd like to do now is transition and introduce our keynote speaker, Mr. Adam Beck, who will talk to you today about the role and the value of the employer market in healthcare. And I will just say, for those of you who haven't heard it, there's a little state in Vermont who have a hardly known senator who is talking about bringing single-payer health care into the marketplace, Medicare for all. We can debate whether that's getting traction or not, but clearly at a policy level, people are beginning to question the value of employer-sponsored health care, so I think this is a really timely conversation for this. So, Adam, I welcome you to the stage. Thank you.
We know that when you focus on those individual needs, give them the resources, fill the gaps, address social determinants of health, you will see health improve, and when people are healthier, costs will go down. And so it's meeting those individual needs and filling those gaps that's an increasingly critical part of our mission, of AHIP's mission, and of the mission of health plans across the country to improve the health and well-being of every American. Because, look, we know that today a person's health is going to be determined as much by their zip code as their genetic code. Social determinants of health matter, and they matter significantly. I'm proud that AHIP, as well as our industry as a whole, has made addressing these social determinants in a comprehensive way a top priority. And I know that's been a top priority for Blue Cross Louisiana. It's been a top priority for Blue Cross Blue Shield affiliates across the country. Dr. UDVARHELYI has talked about how providers have come to him, how physicians have come to him and said that their patients lack access to transportation, that they don't have access to wellness programs or a lot of the recreation or nutrition that other patients may have. And so BCBS Louisiana has worked and is working with the state, with local parishes, and with community organizations to increase transportation opportunities and access to transportation, to increase wellness opportunities. In fact, one of the best examples that we have nationwide is right here in Louisiana with the Blue Cross Blue Shield Louisiana Challenge for a Healthier Louisiana, It's a lot of Louisiana packed into a quick soundbite there, so we'll avoid using that one if this is going up on social media. But that program is actually making great strides in tackling obesity in this state, in working to address the concerns and the factors that can lead to obesity, addressing them at an early age, and potentially avoiding decades of expensive and life-shortening comorbidities. You've spent millions of dollars in community grants to reduce health and education disparities among individuals in Louisiana's poorest communities. And we know that this isn't just the right thing to do as corporate citizens or citizens in our communities, but it's the right thing to do for our business. And it's critical then to have the buy-in and the participation of employers, of the business community, who enrolls so many of our fellow citizens in group plans. Because frankly, too often when we hear about social determinants, when we talk about social determinants, one, it's viewed as another side project, which it is not. Addressing social determinants must be, and increasingly is, a top priority. Secondly, it's not something that is strictly limited to lower income patients. Oftentimes, rightfully so, it's a focus of Medicaid managed care plans, but it comes up as though this is a Medicaid-only issue. Social determinants of health affect every patient and affect every company in the United States. For Louisianans across the income spectrum and in communities throughout the state, including hundreds of thousands of Louisianans with employer-provided coverage, all of our hard work in paying for value and in emphasizing wellness and in advancing accountable care organizations and in negotiating lower drug prices, all of the things that we do may be for nothing if social determinants are not fully addressed. For even the best ACO cannot work, cannot succeed if a worker doesn't have reliable transportation to get to the doctor's offices or to get to the pharmacy, or if they go home every night to fast food because there aren't grocery stores nearby in their area, and they can't get to a grocery store via public transportation if that's what they rely on. Or if they lack affordable child care, if they lack good schools to send their children. Health will not improve the way that we need it to. And so employers, and therefore employer benefit plans, benefit from a more thriving community. They benefit from a community where individuals have reliable transportation, where they have quality education and safer streets. And businesses have the capital, they have the incentive, and they have the reach to impact these directly or to advocate for the government involvement or funding that may be necessary to advance these. Given the amount that businesses spend on paying for health care, any business is so invested in reducing health spending that these end up being projects, again, that aren't just the right thing to do. They pay off. And so they make sense to have such invested partners among the business community whose motivation to impact their community and to improve social determinants is increased because they offer employer-provided coverage. Having employer-provided coverage allows us to have the investment and the buy-in across the country of employers who can not only help move innovations, as we see, not only promote wellness, but to be more invested in their communities and address social determinants of health. This program succeeds. Employer-provided coverage makes sense. Because at the end of the day, all of these efforts to improve population health, to improve the health of our families, to improve the health of our communities, they improve the health of our businesses. And regardless of what business you are in, regardless of what product or service you sell, if you are offering health coverage, you're also in the business of health. And that's where the expertise and the commitment of health plans like Blue Cross Blue Shield Louisiana is so critical. And so my final point, I think, is perhaps the most important that I really want to drive home. And that's that what we see today in an era of guaranteed issue and unified risk pools and a recognition of value-based design, what we see at the end of the day is that our product is not just insurance. Our product is health. Better health for our consumers, and beyond that, better health for our entire community. Because we recognize that the health of the community is all of our health. We recognize that anyone, rich or poor, young or old, is someone who next year could be a part of one of our plans. And so we only succeed. Literally, the only way that we can succeed as an industry is if every single one of our consumers is the healthiest that they can be. And when you think about it, there's really no other industry, not a single one in America, that can say that. No other industry whose sole priority has such a vested interest in strong communities with good schools, and in safe streets, and reliable transportation, and access to nutrition and clean air, and yes, great medical providers, and jobs with benefits. Because we only win when everybody is as healthy as they can be. And we know that those elements, those social determinants, are critical to ensuring that that can actually happen. Because every incentive that we see as a health plan is tied to that. And so we need to keep making that case. We need to keep making that case to our clients, to our potential clients, as well as to the general public and to the government at every level, that we are in this for the right reasons. And we have the expertise, the skills, the commitment, and yes, the incentives to improve the health and wellness of those around us. We strive every day to innovate, to get better, to correct mistakes. And we should be proud of how this hugely important industry makes American businesses and all Americans healthier, stronger, and more secure. And so I appreciate the opportunity to share that message, to talk about why employer-provided coverage not only works, but it makes sense, and it deserves to be protected. It's something that we want to promote, and it's essential not only to our economy, but to the health of the hundreds of millions of Americans who are enrolled in these plans. And so I thank you not only for the opportunity to be here, but for listening. Thanks. For employers, they get employees who show up every day and are at their best. They're healthy, they're productive, and they're not worried about whether or not their kid or their spouse is not going to be well at home. And one of the things that we also work with plans to do is make sure that we're focused on more than just paying out claims. It's about making sure that they're financially well, that they have wellness in terms of what they're able to do when it comes to focusing on things in terms of work-life balance. And so these plans really are about more than just financing healthcare. They're about making sure that employees are able to be at their best at work every day, and that's what we all need.
And what kind of results have those companies seen?
Well, look, when it comes to the price of care, we all know we're all paying too much. We acknowledge that across the board. We need prices to come down. We need things like hospital costs and drug prices to come down. But we see very modest increases in employer-provided coverage plans. And so I think what a lot of these companies get is loyalty, and they get better retention rates from their employees. They get, again, more productive employees, less turnover, increased morale. I think that they are able to make sure that, in addition to obviously wanting to pay their employees a fair and a good wage, I think a key part of that, the other side of that, is health benefits have come to be something that we expect, in part because we need that, and this system makes sense as the way to deliver those benefits.
My name is Mike BERTAUT. I'm an economist. I work for Blue Cross and Blue Shield. My office is in Baton Rouge. And I'm very honored today to host this panel of distinguished people who are going to share with us their views on some of the problems and challenges and solutions that we see in the healthcare marketplace for business going forward.
If those of you that aren't familiar with Lobby, we're the state chamber, the State Manufacturing Association. We represent employers of all shapes and sizes from around the state. And so what we try to do, and I spend a lot of time in my car on back roads all throughout the state trying to go and sit down with our members in their office environment and hear what their concerns are. And a lot of times you'll hear concerns about workforce or tax code or legal climate or infrastructure, kind of your typical business issues you would expect. But it is amazing the number of times that when you talk to them, what they really talk about is you know, all they want to do is focus either on their customers or their employees or their infrastructure, and they're struggling trying to come to terms either with a new regulation or a changing shift in a health requirement, and they just don't know where to go. They want to do the right thing. They want to provide the best benefit for the best price to their employees, but sometimes they feel lost. I know many of you are in the healthcare profession, you know, full time, so you're very familiar with all the acronyms and lingos, but just so you know, a lot of folks out there who are very smart, capable people get very intimidated and frustrated on the healthcare options that are available. And so even if there's a great option sitting right in front of them, many times it's kind of camouflaged in acronyms and all, and it's hard to see. And so we kept hearing those stories over the years. And so what we did as an organization is we put forward what we call a benefit center. And the reason why I bring it up here is because our primary partner in that effort is Blue Cross. And from day one, they've been a great partner for us to provide options for our employers around the state. And so in my mind, we kind of view it as a pre-ACA world and a post-ACA world. And in the pre-ACA world, we would sit down with employers and figure out exactly what their needs were and try to put together a unique benefit offering for them. And again, Blue Cross was there with us the whole way. And we were able to really tailor that up or down, left or right, depending on what they needed from a price or a coverage perspective. And it really worked well. You know, obviously ACA came in, and you know, some folks like it, some folks don't, but the goal was to try to have more consistent coverage out there, one of many goals. And so what it did is it limited a lot of the flexibility we could do, go sit down with members and provide that. And so in that, you know, post-ACA world, we went back and sat down with our partner at Blue Cross and said, okay, what do we do now? Where do we move next? And again, we've put together some interesting blue chip plans that, with that same philosophy of trying to meet employers at their front desk, at their store counter to give them solutions. And so I tell you all that because if you're looking for options, you should go to our benefit center. We have a Blue Cross plan that's very acceptable and affordable there. We have other things like compliance costs with HR, ACA dashboard to give you some ideas on when you have to file a certain paper, when you don't. We're always worried about things, you know, employers try and do the right thing, but they get caught in an audit trap. And while they think they're in compliance, a couple years later, oops, they get a letter from the IRS, they're not in compliance. Well, we try to provide tools that literally calendar updates on your computer that tells you when to file, when not to file, what record to keep, which one to shred, things that allow an employer to do the right thing on the benefit side and focus more of their time and attention on what they started the business for in the first place, which was to hire people, invest in the community, deliver a product that customers want. And so that's what, you know, we try to do. We're not the healthcare experts. We try to be a conduit to solutions, and we think our benefit center is a good option there. You know, another thing I would just say real quickly on that is, when, again, in my mind, we break it in pre-ACA world and post-ACA world. So a lot of our members would come to us over the years, and this has been for decades, and talk about healthcare concerns on one issue or another. And a lot of time, their primary concern pre-ACA was they would say, help us stop a lot of mandated costs going on coverage. We have to be aware of that. And so that's what we would say in the Capitol, whether it be in Baton Rouge and DC. Well, in the post-ACA world, where a lot of that coverage is required by law, good or bad, one way or another, we don't hear that anymore. Now what we hear is, what are some creative things we can do to make sure we're delivering the right benefit, that we're, you know, maximizing cost and coverage and all that. So we're starting to hear things like, help us figure out a wellness program, help us figure out a way to put more clinic-based options on site, on our office, and we can talk about some of that later, but it is very interesting from our membership. We're still trying to provide services to them, but the pre-ACA and the post-ACA world, they're still coming for help, but their questions are now different. And so we just try to be a one-stop shop the best we can to give them the solutions they need. So thank you all for the opportunity to be here. Look forward to sitting on an exciting panel with my fellow colleagues.
Excellent. Thank you, Stephen.
We at the Business Alliance are really focused on growing and diversifying the New Orleans economy. So what does that mean? We need to make sure that we have other segments of our economy besides tourism, hospitality, which is huge and wonderful, and thanks to the Hyatt, you know, maritime or agribusiness or oil and gas. And one of the areas that we really focus upon, we realize there's going to be a great opportunity in the area of digital health, you know, where technology and life sciences intersect. And we came up with this idea of having a program called New Orleans Health Innovators. And it was really Blue Cross and Blue Shield that stepped up and brought Ochsner to the table and allowed us to launch a great event last year where we had companies from all over the world basically try to solve problems that were provided by Blue Cross and Blue Shield and Ochsner. And in fact, Blue Cross and Blue Shield had a diabetes challenge, and that company that won that competition is now working with Ochsner and I think with Blue Cross and Blue Shield. So thank you very much to the Blue Cross and Blue Shield team. Let me try to frame my comments around 3 quotes. So the first quote is a quote from Charles Darwin. And it is not the strongest of the species that survives, nor the most intelligent, but the one most responsive to change. And I think that's very appropriate in healthcare, particularly in the area of digital health. Louisiana ranks, depending on where you look, in population health, 49th. We know about the chronic conditions. If you look at sort of monitoring of diabetes for folks who are Medicare enrollees between the ages of 65 and 75, the U.S. averages, or the best of the U.S. is 91%. Louisiana is 83. Here in Orleans Parish, it's 79. Well, digital health can help folks electronically monitor their diabetes and other chronic conditions using their mobile phone. No matter whether you're 65 or 75, everyone gets pictures of their grandchildren or their great-grands, or they're getting texts or calls. So digital health is the promise of helping people live better lives. And I think, secondly, I would say digital health has a tremendous opportunity with regard to mental health issues. I mean, a lot of our friends and neighbors are dealing with a lot of challenges here in New Orleans, although we are 13 years hence. But there's still people dealing with the trauma of the tragedy of Katrina or the BP oil spill. And there's a lot of stigma of going into a doctor's office. But through a lot of digital health applications, you have the opportunity to remotely get that type of help in the privacy of your own home without your employer knowing. And those are the type of innovations that I think are going to be critically important. But I'll just be blunt. We're in the business of, at least I'm in the business of economic development. And economic development comes in the bottom line, and Michael Heck and Ben Johnson can talk to you further about this. The bottom line is we're in a global competition for capital. Capital is mobile, and it's not loyal. It only goes where it can replicate itself. And because of that, we really need to think about and have an economy that makes sense in the areas that are most attractive for capital. So I want to close on a stat, and then I'll give you 2 quotes. In 2016, 60%, 60 of all initial public offerings, that means when companies go public and they are traded on, whether it's the New York Stock Exchange or the Amex or whatever the various stock exchanges, 60% of them were either in healthcare or tech. 33% were in healthcare, 26% were in tech. Digital health marries both. And there isn't a city in America that has yet claimed the mantle for digital health. I think that's the great opportunity for New Orleans. That's why I'm so excited about it. That's why I'm so grateful for Blue Cross and Blue Shield's leadership in this. And then let me leave with, before I cede the mic, on 2 quotes. One is an unknown doctor said that statistics mean nothing if it happens to you. And so healthcare is deeply personal. And I really believe that digital health will afford more of us and more of our friends and neighbors the opportunity to live their best, most healthy lives, because, you can say, well, the economy is booming and this and that, but if it happens to you, it doesn't really feel that way. And the last quote is from the great mathematician Paul Erdos, and some of you, I know Blue Cross Blue Shield has some of the most predictive analytic minds in the world, so they probably have an Erdos number, and I'll tell you later what that means if anybody cares about it. But Paul Erdos was this incredible mathematician, Hungarian, who escaped the Nazis. And if you have touched math, you've been touched by this guy. And his quote is, and I think this is the promise of digital health, is it is not enough to be in the right place at the right time. You should also have an open mind at the right time. And his greeting with everyone was, hello, my brain is open. And that was Paul Erdos. And I think that's the opportunity with digital health. So thank you so much.
For the New Orleans Chamber, we're over 1,300 members now. 91% of our membership is small businesses. 61% of that 91% is employees 5 or less to a firm. So we mirror national chambers that is skewed towards smaller businesses, especially the entrepreneurs that are getting their businesses up and running. It's a great privilege to work with you all, and it's good to see so many members in the room. I see several of my board members here, and I want to thank you all for coming out. What I've done over the last couple of weeks is just talk to some of our small businesses, skewed it toward 20 or less employees, and asked them for their pulse of how healthcare is serving them. Non-political conversations, just asking them, how does healthcare serve you? How does it serve your employees? And there were kind of 3 storylines that came out of this. The first one, they found healthcare to be very confusing and always changing. The second storyline focused more on that it's expensive and the better packages are geared toward larger companies. And the third, that they indicated their healthcare was essential to retain their talented employees. Fascinating conversations. Under the concept that it's confusing and ever-changing, here's some sound bites. Obamacare was not perfect, but as health care is being revised, we do not know what the health care plan is. It's a moving target on a daily, weekly, monthly basis. They talked about the 50% rule. For a small business to get 50% of their employees to agree to it is very difficult. The younger folks don't want to participate, and many of the other folks that are married, they're on their spouse's plan wherever they work. 3 more points on this, and I learned some things about this. Several small businesses use some form of outside experts, so benefit administrators, similar to what Stephen was talking about, professional resources to sort out the best options for their company. Some have to join co-ops so they can become a part of a larger mass to get better prices as well as better services for their employees. And then some have just literally outsourced their staffs. They've joined a PEO, the Professional Employer Organization, and they really move their staff out of the office administratively, and they work for them, and they have great healthcare services for those staff members. One of the things I really appreciated was every one of the CEOs said they want to offer health care benefits to their employees. They do not like to be responsible for choosing the package. They think that's inappropriate. They think each person has different needs, family scenarios, and they just don't feel right being responsible for choosing other people's health care. The final thing is their budget. It's hard to plan an annual budget when healthcare continues to change, and midstream you got to be able to make up for it. The second topic, that healthcare was expensive and geared toward larger organizations, I had several of the smaller businesses. It could be a married couple, it could be 2 professional people that came together, and they said it's just out of their ballpark. They're paying an annual premium for 2 people for $18,000, and they have the high deductible of $6,000. They do not intend to use the health care at all. It's a lifeline for that catastrophic health experience that you know you're not going to go bankrupt and you can get services. Another scenario on this is small business owners, the spouse could not afford health care, so one of them had to leave the company, work for a larger company, and brought that health care back to their organization. And then the final thing for them is just the frustration that it's not that level playing field. You can't compete with larger companies with a more reasonable package, better services, benefits, and be competitive for the talent that you need for your small business as you grow it. And then the final one is exactly that it's this issue that healthcare is essential as a benefit for them. They said these younger folks, if they need healthcare or want it, they just jump ship in a heartbeat. I mean, they're on to the next company doing the same job, but they're getting a better package. And a lot of the folks just find that frustrating. Two more areas I touched base with them on was if they had any suggestions, and several of them talked about the tax credit. They encouraged Congress to keep the tax credit. It's a penalty to a couple because one spouse member can offer the other spouse health care, and when you're in a low income or moderate income family, that is a huge financial liability versus the couple choosing which program would work best for them. And then the final one that they suggested is they want to know that they can afford affordable insurance for their families and their employees. I mean, just to a person, they feel a responsibility as an employer to be able to offer this back to their company. The final question I asked them is if they had any suggestions for Congress. They have a couple. They said health care for small businesses is not about politics. It is about health benefits, costs, and retention of staff. This is a high priority for all small businesses. I love the next one. Stop letting Congress be exempt from the health care program they create. Those who make it, take it. And I think the crisis of health care would immediately be resolved, and I think we'd have some great programs out there if all of our representatives had to participate in it. And the final comment was asking them to create a predictable, affordable playing field in the healthcare field. It's vital, you know, to have a healthy staff to begin with, but have that benefit to know your employees have that resource. And it was just kind of an eye-opening kind of a conversation. There was no political baggage being brought to the table. This is a national issue. It should be resolved nationally, and small businesses should be upped on the lever of priority given the fact that they're helping drive the United States economy. So I share those informations from the members of the New Orleans Chamber.
I want to thank Blue Cross Blue Shield and Dr. Steve and Michael and our board member Dan Wagner and everybody for being such great leaders and partners to all of us in the community. What I'll end this with is soapboxing for just 2-3 minutes on the fact that occasionally I will meet somebody, occasionally somebody who's in an office, and or like a state-elected office, and they'll say that healthcare is important, it creates healthy citizens, but it's really not economic development. They'll say maybe it's community development, it's good for a healthy community, but it's not economic development like a manufacturing plant or something. And yeah, that's usually my reaction, is that kind of one. It's an absurd thing to say, and here's a couple of ways to prove that. I know I'm preaching to the choir, but you're indulging this. Bloomberg had a report that came out recently reporting on, I think, some Forbes studies that the two industries with the highest paying salaries in the country are technology and healthcare, in that order. And then this is kind of grist for you, Quentin. Well, guess what are the two industries in which Greater New Orleans is #1 in the nation in terms of percentage growth? Technology and healthcare. We have about 77,500 healthcare jobs in the region. We grew over the past 5 years 25% compared to the national average of 18%. And when you look at those salaries, which, okay, they're not the salaries here yet, but it shows we are placing our bets in those industries that are creating the jobs that create a diverse economy and middle-class wealth. The other way to slice this is to look at destination healthcare, which is kind of a favorite topic of mine. And the stat that I read, which I've never been able to get out of my head, despite losing my brain, is that 25% of all of the hotel stays in Houston are because of people that are going to the Texas Medical Center, that are going to MD Anderson and the surrounding hospitals. And when you think about the fact that those are not people coming in for one night, right? They're coming in for extended stay, they're bringing family. It doesn't take much to understand the economic impact that's having in the economy in Houston in general. And so then I flip to us here in this region and say, well, you know, what can we be? If oncology is Houston and maybe, I don't know, cardiac care is Cleveland Clinic, just to throw ones out, what's that area? And the one that I keep coming back to, and it tends to be reinforced either because I'm right or people keep asking the right questions, is neurology, and particularly neurodegenerative diseases like Alzheimer's. And the thinking on this is kind of like a Michael Porter Five Forces approach. One, unfortunately, it's a growth industry. There's no cure for these diseases, and the population over 65 is going to double by 2050. So these diseases, these cognitive diseases of aging, are going to be growth diseases for us, and I'm sure many of us have family members that are currently suffering through these diseases. The second is that, as far as I can tell, nobody's really cornered the market on this from a brand standpoint. There's not the place that you have to go if you get a really bad diagnosis in this. The third is that we've already got some great momentum here when you look at the work that's going on clinically at Ochsner, when you look at the research work that's going on at LSU or at Tulane HCA. And then you look at just the overall context and what else is happening here, even things like the fact that we have one of the biggest, most beautiful VAs in the country, and they're dealing with traumatic brain injury, or we've got the New Orleans Saints, and the NFL is dealing with repetitive concussive industries, although now that you're no longer allowed to tackle, I guess that'll go away. Or you're looking at Steve Gleason and what he's doing with ALS. And you realize that there is the basis here to really create an industry around destination healthcare, and that meets the most pure definition of economic development, because economic development is fundamentally about other people's dollars, which is kind of a crude way to say it. I think economists talk about export industries, which is a much nicer way to say it. But basically, you want to take other people's dollars and bring them into your political jurisdiction. And destination healthcare is proven empirically to be one of the best ways to do that. And so when somebody tells me that that healthcare is not economic development, they usually get this 5-minute lecture, so they tend not to do it a second time. Thank you so much.
So I think today's been great. There's been a lot of positive energy. I would say people have been really engaged. The breakout sessions were, I think, really informative. And what we liked this year is we added something where we created informal dialogue at tables over lunch for people to talk about the issues that were important to them. So we continue to improve it, and we look forward to continuing this in future years.
If people have questions like more information, what should they do?
Well, the best thing is they can go to our website, www.bcbsla.com, and they can find out more information there, not just about this event, but about healthcare in general.